Thank you, Micheál Corlett. Taoiseach, over the last year, I have raised with you the situation and the plight of Section 39 organisations, particularly hospices, and the fact that they didn't get any fair deal from the government in terms of the restoration of pay under the turnaround of FEMPE. And while the government's position has shifted, overall it has been mean-spirited and has lacked any moral compass. Now, in addition to hospices, Taoiseach, you know there are many agencies and organisations out there who are labelled Section 39s, but who in essence do the state's work in catering for people with disabilities and children with special needs. We know that thousands and thousands of people across the country depend on such organisations for residential services, for respite services, for daycare and support services, for personal assistance, for home care assistance and access to therapies. And we know for many of those people that even those services are not fully adequate or fully sufficient. Just take respite and access to therapies, for example. I'm talking about organisations like Enable Ireland, Rehab, Acquired Brain Injury, the Wheelchair Association at national level, those organisations, regionally Ability West, Western Care, Kerry Friends, St Joseph's in Charleville, which covers Limerick and Cork. Now, there simply would be no services for people with disabilities without these organisations, Taoiseach. And in research commissioned recently on behalf of these organisations entitled Who Cares?, the reality is brought home in terms of the financial crisis that these organisations are now in. They're financially no longer sustainable. The lack of honesty from the government in terms of honestly meeting the real actual cost of services that are being delivered on the ground by these agencies. It's important research. In essence, the report captures that crisis and that lack of honesty in the relationship between government and these agencies. Because the government has compounded the crisis, has made it far worse in terms of the restoration of pay for the workers in these organisations, because they are not getting the full restoration of pay. And there is a significant differential at the end of each month now between workers in these organisations and workers in the health service more generally. And the question has to be asked, Taoiseach, and I ask you, why is it that in this country those agencies and those workers who look after people with disabilities and look after very sick people in our society, that they are penalised so blatantly by government through its pay policy?
Thank you, Deputy.
And discriminated against so much? To me, it suggests a morally bankrupt position for government to adopt. It places these agencies in financial peril and will result in the cutting of services.
Thank you very much, Deputy Taoiseach.
Thanks very much. We provide our health and social care in Ireland through a number of different mechanisms, sometimes provided directly by the state through, for example, the HSE, sometimes through a Section 38 body, which is a voluntary body. St. Vincent's Hospital, not too far from here, would be an obvious example, where the staff are considered to be public servants, but the body itself is not part of the public service, sometimes through Section 39s, and you've mentioned some examples of Section 39s, and in these cases the body receives some of its funding from the state, often some of it from other sources, and the people employed there are not public servants, and also sometimes it's done through private contracts. For example, most of our GP services, most of our dental services are provided by GPs and dentists who are self-employed, and they in turn have staff, and those staff are not on public service contracts and aren't part of the public service pay bill. So that's how we structure our health and social care services in Ireland, providing those services in lots of different ways, sometimes directly by the state, through state employees, sometimes through private contractors like GPs and dentists who have their own employees, sometimes through Section 38 bodies, and sometimes through Section 39 bodies. And that's the way it has grown up, for better or for worse, over the past century since the foundation of the state. When it comes to pay in the Section 39s, there was a dispute. It went to the WRC. We have an agreement, and I'd expect the employer and the unions to honour that agreement, and I'm sure that they will. In relation to funding, I don't have the exact figures in front of me. I will dig them out. But funding for Section 39 bodies has increased for each of the past 3 years. And funding for Section 39 bodies has actually increased at a higher rate than funding for the HSE and its own services. So while HSE services got a certain increase, the Section 39's got a bigger increase than the HSE got. So that assessment that you offer doesn't really add up, because if the HSE bodies are getting less of an increase than the Section 39 bodies, the Section 39 bodies, which have got a bigger increase, should be well able to afford any additional spending that the HSE bodies are providing.
Taoiseach, I don't believe you're living in the land of reality in terms of these agencies, and I think you are in denial. And so is government. And we've met with the Department of Public Expenditure, the Minister for Finance. The bottom line is, Taoiseach, I'm not offering up that analysis. It's commissioned research, which you should read. But it's also the reality on the ground. I've met St. Joseph's in Charleville, who do heroic work and have for years. We all know about the history of the relationship between the state and these organisations. The more recent history is that government instructed the agencies to cut the pay in line with FEMPE. But when it came to the restoration of pay, they were left out. And this was never an IR issue. The unions will look after their members, but what the unions haven't done is look after the agencies, and won't. It's not their remit. Because in many posts will not benefit from the pay restoration, because if workers came after the cuts, they don't get any restoration. So the agency gets no funding for that. They get no retrospective funding in terms of those agencies that have actually paid pay restoration. So the situation is very grave for organisations like Kerry Friends, like Ability West, like St. Joseph's, like the hospices, who have told me they will be cutting services in January. So that's the reality, Taoiseach. And I think they have been short-changed. I think what has happened has been fundamentally wrong, and they should have been kept in line with HSE, which was always the case, and which had been underpinned by Labour Court recommendations down through the years, and indeed since 2010 onwards. And it's not fair to say what you have said in relation to them.
Taoiseach.
Deputy, as I've said before, these bodies are all very different. Some Section 39 bodies are very small. They may only receive 10 or 20,000 euros from the HSE. They may have only one employee or a part-time employee. Some are very large and have a large number of staff, provide a large number of services. Sometimes they have very little other income, other than the income they get from the state. Sometimes they have very large income which they either raise themselves, they get from bequests, or raise from their assets, because some of these bodies have substantial assets and substantial surpluses as well. So each of these bodies is very different. And what's done is a service level agreement is put in place with the HSE, and that body receives a particular amount of money in order to honour the service level set out in the service level agreement, and that's the way it's done. It's similar to a contract that might exist, for example.
Thank you, Taoiseach.